is catastrophic for our patients. And this is what we need to call it what it is. It's moral injury, and it needs to be addressed head on. Our well-being and future of our healthcare and our patients depend on it. So what causes moral injury in healthcare? It's infuriatingly clear our suffering isn't just a matter of individual stress. It's a systemic failure. We're talking about the crushing burden of inadequate resources. If you've ever been told, no, we can't give you an MA, no, we can't give you a scribe, that's moral injury. The mind-numbing maze of administrative tasks where you can't click the boxes, you can't delegate to your nurse, you have to click the boxes yourself for some unknown reason. That's moral injury. And the endless bureaucratic red tape that chokes our every move. No, you can't prescribe this medication because it's not on formulary. No, you can't give this brace because it's not on formulary. No, you can't do this for your patient because the insurance company hasn't approved it. That's moral injury. We are forced to jump through the hoops to make decisions on financial constraints, not our own, but the insurance company's financial constraints. And we are then told that this is the best care. When they haven't gone to medical school, they haven't known their patient, and they're telling us this is best for them? No, this is best for their pocketbook. This is not best for the patient. And that's moral injury. When you have these things where you are told, oh, they didn't approve it, you're going to need to do a peer-to-peer review and peer-to-peer, right? Are these really your peers? Do they actually know how you treat your patients? No. And so this is a war of attrition. It has been clear that the insurance companies, by default, deny everything. And then it's up to you to jump through this hoop and that hoop and this hoop and that hoop. And it's a war of attrition, right? If you can just hold out long enough, you can just do enough to get the care approved, they finally give in and approve. But they're betting that 8 out of 10 won't do it or can't do it or don't have enough resources to continually jump through these hoops. That's moral injury. If you have experienced any of these things, you're not suffering from burnout. You're suffering from moral injury, where it's pulling at your heartstrings because you know what the right thing is to do, and you know your patient and what they will benefit from, and you're being told you can't give it to them. And that puts you in the crosshairs. That puts you not on the same team as your patient, but on an opposing team. And that erodes that doctor-patient relationship, that sacred relationship where they know you're doing everything that you've sworn to do to take care of them. And that is being eroded by this third-party intervention telling you what you can and cannot do. Now, I've figured it out, and I can help my colleagues along the way with a much more streamlined approach where we can get you up and running very quickly to be able to care for patients in the nature you see fit.